So implants versus dentures. Our patients want to know what's the better option.
Oh, okay. So, I mean, that just depends on the patient really. But what I can do is, I suppose, talk about implants and then talk about dentures and where they're maybe suitable for a different type of person. Implants are a screw that gets, a titanium screw that gets screwed into the bone. And the first thing is there needs to be an assessment as to whether somebody is a candidate for it. So because it's being screwed into the bone, somebody needs to have enough bone there to be able to actually do the implant. Cost, I suppose, is a factor when it comes to implants as well, depending on how many are needed. Is it one implant? Is it, 4 to 6 maybe on the upper arch or 4 on the lower? So it does vary from person to person. Obviously, when you have an implant, because it's a screw in the bone, it stays in. So it's actually there. You don't have to take it out. So that's definitely a positive for it. But if there's any kind of gum disease, you may not be a candidate. So again, we'd look at bone, we'd look at your oral hygiene, making sure that there is, no gum disease there, that there's no risk of you losing the implant, because if you've lost a tooth, there might be a risk that you've lost, you've a reason behind maybe losing the tooth, you might lose the implant as well. So we don't want you to put that cost into having an implant and then lose it very soon after. I suppose with dentures, the pros of dentures is that you can take them out to clean them. They're quite easy to clean. If you break them, they're easily replaceable. Cost-wise, we can replace a number of teeth at the fraction of a cost of having maybe a full arch, restoration with implants. In terms of the pros, you can, reline them. You can have them refitting. The gum work is extended up into your mouth, so you can have nice, support for the lips, for the gums, for the cheeks. So it's a little bit like a mini facelift when you're getting your work done. So it does look amazing. There's lots of benefits of the removable. And I suppose if you've a gap on one side, maybe a partial denture. So a lot of people talk about partials and full. So full is where you're missing all of your teeth. Yeah. Partial is when you've got the gaps. If you have one gap here, one gap here, and one gap here, it might be quite costly to have 3 implants to fill those gaps, whereas we can actually do that with one removable denture. So there's really benefits and positives for both sides of the talk, I suppose. And I think at the end of the day, it comes down to the person. So I'd always advise, come in, have a chat. There's no obligation. See where you need to fill the need, what's the best solution for that specific person, and then we take it from there.
Okay, thanks, Bevin.